Up to 70% of all women with PCOD or PCOS struggle with controlling their weight and are obese because they have higher than the normal insulin level. Controlling insulin through balanced diet can have many benefits in PCOS. The wrong kind of diet, high in refined carbohydrates and trans fats, can make insulin resistance and therefore difficult to control weight loss. PCOS is typically earmarked by irregular menses or no menstruation, which means ovulation occurs very rarely or does not occur at all. Women with PCOS have multiple cysts into their ovaries caused by overproduction of DHEA, that is dihydroepiandrosterone, the precursor of testosterone. Women with this disorder are overweight and they have symptoms like acne vulgaris, acanthosis nigricans, that is blackish line on the nape of the neck and in axillary region. This is due to insulin resistance. Then hirsutism, excess hair growth on face and on the chest, and male pattern baldness. When these symptoms are not controlled, the women are at the higher risk of developing hypertension, diabetes, dyslipidemia, heart disease, endometrial cancer, and anxiety neurosis. Women with PCOS can control all these symptoms and prevent the medical complications by controlling their diet and lifestyle. The key fact in PCOS is that the food is medicine. Acharya Charak says, Aharasya paramdhamam shukrantana parasmrito, which means the balanced diet results in healthy reproductive system. About exercise, Acharya Vagbhat says, Laghavam karma samarthya diptor agni medasakshaya vibhakta gana gatratvam vyayamadupa. Regular moderate exercise results in improving metabolism and stimulating digestive power, which in turn removes excess kapha dosha from the body, which helps in PCOD. So the diet in conjunction with exercise can help in removing the challenging symptoms of the PCOD. And the most important thing, even a weight loss of 5 to 10% of total body weight can improve ovulation by 50%. The essence of eating to heal PCOS is to consume food in its real and natural organic forms. Learn to distinguish between simple carbohydrates and complex carbohydrates. Simple carbohydrates are refined sugar, fruit juice, corn syrup, white bread. They are quickly digested in the body, spike blood glucose, wreaking havoc hormonal levels. Complex carbohydrates, legumes, cereals, millets, whole grains, whole fruit, vegetables, they are present in all these food. They are slowly digested in the body due to the presence of fiber, therefore helping effectively to control blood glucose level. As thyroid, insulin, cortisol, progesterone, estrogen, testosterone, all these hormones become in balance, the PCOS symptoms can be controlled. Here are 9 diet rules in PCOD or PCOS. First, limit processed foods. Avoid processed and refined foods such as white flour, that is maida, sugar, pasta and white bread. Instead, eat whole grains free from glutens like brown rice, millets like jwari, bajri, ragi, amaranth, that is rajgira, and quinoa. Increase fiber. Eat more foods that are high in fiber. As fiber slows down digestion, it helps to combat insulin resistance. Third one, drink more water, at least 2 to 3 liters water per day. In Ayurveda, Shadangodak or Shunthi Mishrit Jal is advised. That is, in 1 liter water, 5 gram of dry ginger powder is added, and after boiling, the water is filtered, and by making it cool, have that water. This water helps to remove the vitiated kapha dosha in the body, which results in improving metabolism. Fourth one, avoid refined sugars, high fructose corn syrup, artificial sweeteners like aspartame, sucralose, saccharin, artificial colors, monosodium glutamate, trans fat, and high saturated fats. All these food should be avoided. Fifth one, less ingredients. Primarily avoid packaged foods, or in case if you take, prefer food that has less than 5 ingredients in it. Sixth one, limit alcohol. It is better to avoid alcohol, or in case if you take, make an alcohol on occasional indulgence. Remember, a glass of red wine is fine once in a while, but after that benefits are reversed. Seventh one, microfast. Eating after sunrise and stopping it with sunset is one of the ideal and best tradition to follow. So in metabolic diseases like PCOD or PCOS, have a lunch between morning 9 to 11 am and dinner in the evening 6 to 8 pm. In between this time, you can have fruits and some healthy snacks. Eighth one, balance carbs and proteins. Always combine proteins and complex carbohydrates in every meal. And the ninth one, avoid hoteling and outside fast food. For that, always carry your own food with you. This helps to you have a healthy choice. So, PCOS is lifelong disease. It is important to understand that there is no any magical formula or pill to cure PCOS, but by making dietary regimen changes and improving lifestyle, many of PCOS patients are able to manage their symptoms, improve fertility, and lead fulfilled lives where they are happy with their bodies and the way they look. Thank you.